We have a good number on, so we're going to start. For those of you that just joined us, my name is Kimber Sachs. I am in the planning department at Mount Sinai Memorial Parks. I am joined by a great panel tonight. We are here obviously to discuss life planning for special needs children and adults. Becca, my colleague who's on, works with me at at Mount Sinai, and she and I talked for a long time about what to call this webinar, and we consulted with our other panelists, and it was tough because when you think of the umbrella of special needs, there's, as Michelle brought up, diverse abilities, different abilities, disabilities, and at Mount Sinai, and as well as many other organizations in Greater Los Angeles, we're here to serve the entire community. So it's not for me or any of the other panelists to decide what we should call it or who's included. We invite everyone and whoever is here, to hear and join with us and learn from us or with us. We welcome you. And I know that everyone on the panel is touched by this personally. So we're either parents or siblings. And interestingly, we also have dedicated our lives to careers where we help the families. And it was interesting in doing a little bit of research. I'm just a moderator, so I'm not I am a mom of special needs, but I read that for siblings especially, this is like the single most influential thing in their lives. So I don't think we're even going to be able to scratch the surface, because this is, quite frankly, one of the most emotional topics I've ever come across. But what we can have is a pragmatic discussion, real life, about things that we can do to benefit our families, our children, our adult children, and hopefully you find some value in it, because we are really pleased to share with you tonight and be here to help our community. So first I'm going to ask you to introduce yourselves. I guess we can start with Rabbi Erez Sherman, if you'd like to just introduce yourself.
Sure. Thank you, Kimber. Thank you, Becca. And thank you. It's good to see you, Michelle, as well. So I'm Rabbi Erez Sherman from Sinai Temple. I've been at Sinai Temple now 7 years. In fact, I'm in business with my wife, Rabbi Nicole Guzik. So we work together at Sinai. But I'm not here really obviously I'm always a rabbi, but I'm really here as a sibling, as Kimber said. My brother Eyal, of blessed memory, was a quadriplegic for 32 of his 36 years. In short, he had a brain tumor when he was 4, 1986, and was left a quadriplegic, and after a brainstem stroke, after some successful surgeries, which saved his life, but left him as a complete quadriplegic. As Kimber says about being a sibling, and she asked me a lot of questions as we went along, and I'm only rediscovering a lot of things I did not know. I think it's a really important thing, actually, as siblings. And again, 2021 is much different than 1986. I think that's a really important point as well. The knowledge that is out there, the support groups that are out there, the mental health piece that is huge right now, especially even in the pandemic, but that really wasn't a part of the conversation back in 1986. So I just want to focus on the word normal. And for me, normal meant what we had. I remember when I was in college, a friend of mine came, I'm from Syracuse, and he came with me to visit my family and actually to go to a basketball game and spend Shabbat with us. And my dad is also a rabbi, and he, after the weekend, said, I just want to let you know that was really normal. At first I was offended. So, what do you mean by that? Are we weird people? And said, no, I knew of your brother, I knew your family's story, but I didn't think that when I went into your home and lived life, it would be normal. And that is a tribute to my parents in terms of how they created a sense of normalcy. I do have to say that after he passed, and it was on Rosh Hashanah in 2017. Now, for instance, it's normal, right? I don't have a sibling right now with special needs, but in that case, I wish I had the normal, right? For me, this is actually abnormal. And I bring that up, and then I'll let Michelle speak. The first time that my parents, for instance, they live in Philadelphia now. The first time they came out to Los Angeles, which I absolutely loved, obviously, and at the same time I absolutely hated, because I didn't want them to be able to have that ability, because I wanted to be able to have that normal that I knew as well. So what I'm trying to say in short is confusing. And I think for those of you who are on the call, either with a child or with a sibling or even with a friend, I like to say I see the world through curb cuts. That's how I was taught by the life of a young man in a wheelchair being right by my side. And one of my missions as a rabbi, as a human being, is to open up more curb cuts for others. And I know Michelle has done that amazing, and we'll talk a little later about how she actually helped me before my brother passed in thinking about these things. So thank you.
Michelle, would you like to introduce yourself?
Sure. I was just looking over the names of who's with us tonight, and I know many of you, and it's nice to see you all again. And thank you, Kimber, and thank you, Becca, for inviting me to join with Rabbi Erez to talk about this important topic. So I have like two hats, two kippot. I am a parent of 2 children, a wonderful daughter, Rachel, who's 29, and an equally wonderful son, Danny, who's now 26, and has grown quite the pandemic red beard. For those of you who knew him when he was little, it's hard to imagine him with a beard, but he's got one. And then I'm also a professional in the Jewish community, and I worked at the Federation and a number of other Jewish agencies. And then through the help of Bet Tzedek and a wonderful group of board of directors, the Jewish Community Foundation, the Federation, I ended up being the founding executive director of a small nonprofit, a small but important nonprofit called JLA Trust, and we provide pooled special needs trust. And when my son was he was diagnosed at, I'm trying to remember, like 11 months with global developmental delays. And, we kind of thought, well, we'll just do a bunch of therapy. He's so little. And by the time he's 5 or 6, he'll have caught up. And then, by the time he was 5 or 6, he wasn't really catching up. And then like Erez, I think around that time, we realized we had to take our preconceived notion of normality and, what we thought was going to be our life, and just really, and it's very hard to do this, just throw that away and just really welcome and embrace the new reality. And there's a lot of wonderful people you meet in that journey. And we're really blessed in Los Angeles to have so many amazing organizations that are doing really, really great work for Jewish children, adults with special needs. And, when you're a parent of a young child, you're so focused on school and that development, and it's hard to think ahead 5, 10 years. But with a little bit of luck, little children grow up to be big children, and they're going to be adults a lot longer than they're going to be kids. So it is very important to start planning now. I like to say hope is not a plan. So we're going to talk about some various aspects of planning ahead tonight.
Great. So I want to kind of introduce Becca, but I'm going to let her speak for herself. Becca is my colleague. She works with me in community outreach, and she's been behind the scenes for all of our webinars with wonderful research and helping me with memory care and embracing mortality. And it was really her idea to do the special needs. Being a mother of a daughter with special needs, I was hesitant because it's a very emotional topic, and there's just too much really to grasp. But being a professional and running advanced planning for Mount Sinai, I realized I do this every day. I see these families. I see the difference when they're prepared and when they're not. And more important, I'm deeply touched and affected when there are adult children and there hasn't been planning and the parents are no longer there. So I never really had the opportunity, which, you know, would be something to discuss with Rabbi Sherman later, but, you know, you lost your brother, which is very difficult, but I'm sure you've asked yourself what would have happened if we would have lost my parents first. And that's a whole other topic about often adults or parents not including the siblings in the planning. Sometimes there's assumptions, but with that being said, Becca came up with this topic, and she is studying for her master's in social work. And what's really interesting to me in the conversations I had with her is that she's actually worked with the children. She's actually had conversations and worked with the children, teens, young adults. And so I asked her to join us. So if you want to say a few words, Becca.
Sure. Thank you for having me, and it's nice to be here with all of you. So I do have experience working with children's, teens, and young adults with a range of disabilities. You know, we talked about that. It's an umbrella term. They have their own emotions, feelings, and needs. So many are aware that life may be different for them, and that creates a lot of uncomfortable feelings, worry, and may impact their behaviors. So we just want families to feel empowered. And this is why accessing resources, building life skills, and helping families cope within their family dynamics is very important throughout life's transitions.
Thank you, Becca. You just made me think of something, actually. So as I said, I have a daughter, she's 20. And this weekend, my niece had all of her cousins over. She's getting married and she's had to cancel the wedding 3 times because of the pandemic. So we decided just to get together, you know, to celebrate her. And it was just the family, just the girls. And she was sitting with all of her little, well, not little friends, but late 20s, her girlfriends and some of her cousins. And my daughter said to me, I'm never going to have that. Mm. And at first, I wasn't sure if she meant a wedding, but she didn't. I realized that she meant those girls together. And I thought to myself, she's so lovely, so sweet. She has friends. She lives, I don't want to say a normal life, that term. But it made me realize we as parents are so concerned about our children, our adult children financially, what's going to happen in the future, their physical pain, you know, emotional, but we don't really think about their own feelings or the decisions they might have for themselves. What she was referring to was something very simple. She's had a lovely, I thought, you know, upbringing. She was referring to, she never had the opportunity to have those high school friends or the growing up friends from dance or cheer or soccer. So she was just referring to, I don't have that kind of friend that was my childhood friend or my whatever. So I thought it was really important when Becca brought that up, that we had that other perspective of someone that might be able to talk a little bit for the children themselves. But I want to let everyone know who's on now, we've got a great group, more people have added, that we have a chat box. So if you have questions, that's why we're here. Everyone on the panel has something to share with you, but what we're really here hoping to do is answer any questions that you might have. We really want everyone, I mean, this is what happens in this community. We don't want people to feel isolated or like they're in this alone. And it sounds cliche, but this is really the opportunity to keep these connections that are so important. So please feel free to send me a chat and I will moderate and ask the panelists.
I just share how I met Michelle, actually, because I think it's what you spoke about, Kimber. I think it's important for people here to know, because you brought up 2 things that affected my life specifically, and I guess it was probably 2015 or so. Michelle, you wrote an article in the Jewish Journal about the new Jewish, what's it called again? I forgot, the Special Needs Trust, right? And I went to the meeting in Santa Monica. I had no idea what that was. And for many years, so like I said, I moved out to California. Number one, that was the hardest conversation I ever had with my parents. because the assumption was you're gonna be here and right, and there aren't rabbi jobs everywhere. So that was number one, and therefore number two, we would ask often questions: what will happen when? And rightfully so. And my dad's a rabbi, but he would always give the answer of Hayom. It's about today, right? As Michelle just said, like, I can't worry about when I'm this age because I have to worry about today. How is your brother going to get up and go to school and all those things? And what if a nurse doesn't show up? And I witnessed all of that and I totally understood. But what happens when? And there wasn't really a plan spoken about. And so I sort of went secretly to that meeting. My wife encouraged me and I went and I learned so much. And like what you just said, Kimber, not to be isolated. I'm sort of that ambassador now. We didn't have plans and he passed away fairly suddenly. But that did kick in actually plans for everybody else, which now I look back and it's a blessing that everything else is set. Thankfully, we had relationships that when the plans had to be made, it was okay, but we did not have that aspect. So Michelle was really a savior in those conversations for me personally out here, and sending it back to you saying like, I am preparing for the good. I think what you said, the hope, right? Hope can be prepared for. So thank you.
Right. So I know we need to jump into it, or we can just keep talking and talking and talking. I would imagine, I shouldn't assume anything, but most people who are probably on this webinar are affected by special needs in some way. So we don't really need to give a background of percentages or ideas because we're really here just to connect and learn something. One thing I'm sure everyone knows is with advances in science and technology and medicine, our children are growing into adulthood and living longer. So this brings on all new challenges, physical, emotional, financial, and no, I won't say the most important is the aging parent. You know, what happens to these children and what we can do. So are there no questions yet? Okay, so we're going to jump right into some of the questions that we have. We're starting with, well, we can start with Rabbi Sherman. Should we start with Rabbi Sherman?
Sure.
Okay. So can you, I know you're a rabbi, you're a sibling first, but as a rabbi, like what I hate to say, what can you bring to the table? Like as a rabbi, what can you share with us about this situation as they age? Of course, we know they can have a bar mitzvah and we can do all of these things, but how do we reconcile, this situation, or whether it's a blessing or, life plan?
Yeah, so I think I jumped my turn, so I apologize, but I think I don't want to say excited to share that, but that was really important for me because now I look back at what we didn't plan, and I'm a extreme advocate of that planning aspect. I mean, many people come into my office because they know my story. I'm very open about my story. It comes out in sermons, articles, everywhere because that's who I am. My children also know that story. The kippah that I wear in my head is my brother's that my dad gave me as we recited the vidui, the final confessional prayer, and he said, "This is yours," and that kippah has never changed. Whether it's a wedding, bar mitzvah, that kippah stays the same. So yeah, it's advocating for families to have those conversations, which my family, again, I'm open here because I'm in LA and this is my family now. We didn't have those conversations. So people come into my office saying, how do I do this? They have a young child. And that's not the first conversation that comes up, but I think if advocacy for children and planning for children begin, right, as Michelle said, how do I get to school? All these stages, it really goes hand in hand. So starting the beginning, not necessarily looking at the end, but I think the openness of conversation is just really important. Again, this was not a time, you just said, in 1986, the doctor said to my parents, like, just have a good life for 6 months, right? Well, 6 months turned into 6 years, turned into 3 decades. So like, when do you start? And also I would say there probably wasn't anybody to guide them at that time as well. So if there was a time to guide them, I would like to be that person to be able to have those conversations with others.
Nice, thank you. Michelle, what did you say? What was that quote you said about hope? Hope
Hope is not a plan.
Hope is not a plan. So it's interesting you said that, because I actually on Facebook just recently posted a picture in a hospital bed of when my daughter was first diagnosed. It was 10 years ago. So I didn't have a child born this way. So that's another thing for everybody in this community tonight. Many of you, it's not that someone was born with that or it happened early on or it's developmental. It could have been a car accident or something at 15. It could be an array of things. So everyone on here, the thing is that we all have different, we could be from a single parent, married, it could be divorced, there's just so many different variables in this. But I had put on Facebook, I put this picture and I said, choose hope. This is 10 years. And I got like this wonderful response. But when you said that, I said, here I am moderating a discussion and I don't have a life plan in place. Right. So this is what I do now. I do have this education and this knowledge about all of this. And I'm blessed to be able to research. And I'm sure most of the people on this have researched or thought about these things, but, they don't know, what happens when my child gets older, or how do I pay for it, or how do I navigate? You're so focused on what we as parents want. We want them to not suffer. All we think of is we don't want them to be in pain. We don't want them to hurt. We need to take care of their basic needs. And we worry exponentially about when they get older, but we don't necessarily do anything. I read that a third of all, I just read this, I did about a third of us with children, and there's millions of children, have no life plan. We have nothing planned for the future. And 59%, almost 60 actually, it's like a point whatever, of adult children, the guardian is the parent. So that's a big group that are relying on a parent. And in what I do, unfortunately, I see, the cycle of life, and we all see it and we know it. It's one thing we know for sure. I just did a webinar about embracing mortality. The only thing we all have in common is that we're going to be born and we're going to die. Everything in between can be unique. So we know that parents, this is inevitable. So what are we going to do to help our children in a life plan? What's interesting about a special needs trust, I'm really excited for you to share that because I didn't even know about it, is it addresses the quality of life. It actually addresses things that they can have, food, housing, healthcare, just all kinds of things. It's not, just your state assistance for X, Y, and Z. So maybe you can, just break into that and jump right in and tell us about like resources or what it is that a special needs trust does.
So the reason you would want a special needs trust is because most of those essential government programs that we count on, such as SSI and Medi-Cal, in-home supportive services known as IHSS, all of those limit how much you can have at any one time in terms of countable resources. And believe it or not, it's only $2,000, which is crazy. And don't get me started on bad public policy. But for now, that's how it is. And we have to live, as I like to say, we live with a broken system. So a special needs trust is a legal way to have more than $2,000, keep all those government benefits, and then also even have investment income after with those assets that are in your special needs trust. So
what if you don't, do you need a certain amount of money?
Right. So I'll get to that in just one sec. So with every trust by definition has to have a trustee, right? And I'm not a lawyer, so I only understand these things in layman's terms. So those lawyers out there might, you might pick apart my definition, but the trustee is the person who has that financial oversight of the funds on behalf of the beneficiary. So what wealthy people have traditionally done is they use their lawyers, they use commercial trust companies, or they use professional licensed fiduciaries. And those are great and they do a great job, but there's a little catch. You need at least $1 million for, or at least $750,000 to have any of those professionals become the paid trustee. A lot of middle-class families have traditionally used siblings, adult siblings, as the trustees. It's not the best practice for a number of reasons. Number one, God forbid, what happens if something happens to that sibling, if that sibling becomes incapacitated or dies? What happens if the sibling marries somebody who says, you know what, your brother is fine. We need the money that was supposed to be in the trust. We need it for our own family business. So, and then just in general, it creates huge interpersonal tension for a neurotypical sibling to be named the trustee over a sibling who has special needs. So I like to think we have the right solution that no one's ever heard of. It's called a pooled special needs trust, POOLED. And Congress created them about 26 years ago, and they're all over the United States. But until we got started here in LA with JLA Trust, there was not one headquartered in LA. And as I mentioned at the onset, through Bet Sedek, incubated this project. The Federation gave money for a planning grant, and then the Jewish Community Foundation gave seed funding. So we now have a pooled special needs trust in Los Angeles. I put the website in chat, the URL jlatrust.org. And to answer your question, Kimber, for an active trust, it requires $20,000. And but we also have an option for what we call future funded trusts. So what that is saying is we're just going to set up the trust vehicle now, and then we'll put money in it later. And that's only a $600 enrollment fee. So we're trying to make it really affordable and this is really designed for middle class, upper middle class families. Like I said, if you're really wealthy, you have a good system. Take your millions of dollars and enjoy the system that already exists. And if you're very low income, it's going to be hard to even get $20,000 eventually. Although one very good vehicle is actually life insurance. And I'm not a life insurance broker, and I'm not here to sell life insurance. But life insurance is a way for middle class families to have some financial assets coming to that child with special needs down the road.
So can you deposit into it? So if you started with 600, can you make deposits for a period of time?
Deposit whenever you want. But the way we've set it up, it's going into a money market account. So that's not going to earn much money. We've done that on purpose for tax purposes. So what would be advisable is to actually create a CalAble account. And I'll put that, I will put that in chat for everybody. And these are tax advantage savings accounts. Yeah. They're similar to 529 college share savings accounts, but they can be used for a lot more than college. And you can open those accounts with just 25 bucks. And there's a lot of investment options with those. And there's an FDIC insured option. So I would say to every parent who has a kid diagnosed with a special needs, go ahead and open that CalAble account with just $25. And then at weddings, bar mitzvahs, anniversaries, other simchas, you could put other family members can gift money into that CalAble account up to $15,000 a year. And then
Wish I would have known that.
Yeah, I know, because you get.
I hope everyone got that on here.
Well, it's only a few years old. It's only
Okay.
CalAble accounts have been around about 3 years.
So
The child.
I understand that everyone is getting inundated with information. Like I am understanding half of this, I have to say, and you're doing a wonderful job, but it's a lot of information. So I just want to let everyone know, because some questions are coming in,
Right.
that we are going to send you all an email after this. It'll go out within the week, and we will provide information, all the information that you've heard this evening. We will give some resources, and it'll be up to Rabbi Sherman and Michelle if they want to include their contact information, but I certainly will have mine, and you're welcome to contact me and I can funnel questions to them. But we've all volunteered, and Rabbi Sherman and Michelle are both very busy, but they have volunteered to be here tonight, and they have said, we want to help you. So this is not business oriented in any way. This is about siblings and parents and people who have dedicated their professional career. We want to be of help to everyone. So you said something interesting about, Michelle, you said, if you're really rich, or if you're a millionaire. And I kind of want to touch on that because, and Rabbi Sherman can attest to it. You can be very, very wealthy and have the means to do things, but you still can be, as my mother would say, discombobulated and not know what to do,
Yeah.
not know where to go, not know how to do anything. We actually have a lovely, not a lovely, but a question from someone that touches on what we've all talked about. And she said that she's a single mom. She has one child. She's researched everywhere for information. She's never gotten anywhere. She's at a complete loss. And she's really worried about when he transitions to adulthood. And she actually said, her plan was that her best friend was going to care for him if something happened. And then her best friend passed. So, any resources are greatly appreciated. So, there's an emotional aspect to this. There's a financial aspect to this. There's an information aspect. I just want to let you know, person that asked the question, that we are here for you. We will respond personally to your question. But does anyone have anything to touch on there that they would?
Well, the question about what happens after your child turns 18. So even if your child has very significant disabilities, according to the law, anyone over 18 is competent until otherwise proven in a court of law. So that's why if you want to keep on kind of in the same role as you had with a minor, you would have to petition the court with a conservatorship. And that word has gotten a bad image lately with the whole Britney Spears thing. But there's a special conservatorship in the state of California, which is called a limited DD conservatorship, which is designed for regional center consumers. And what's great about that is it can be really crafted to meet the needs of your individual. And there's 7 different powers. So the parents can decide which powers they feel are essential to keep as parents, and which might the adult child, everywhere from where the person lives to having access to medical treatment, to entering into contracts, and to give or withhold consent to marriage. There are some really good options to conservatorship. A lot of them do utilize a durable power of attorney. So there's different ways to go, but it is really important that parents take proactive steps to either pursue the power of attorney or the limited DD conservatorship once their adult child is turning 18, because otherwise you technically have no right to their medical records unless the adult child signs a waiver permitting you to have access to those.
We have that now when the kids go to college. They're still like little kids and they leave, and then all of a sudden something happens and they say you can't help them. But I want to transition to Rabbi Sherman for a moment, because we're talking about when the kids get older and being a sibling. I'm interested in, so when you are creating a plan, I read so much about whether you're including the siblings in this conversation. More often than not, it's implied that the sibling will care. We have some questions here. Someone said, I have an adult child, but he has no siblings. Mm-hmm. So what do I do? And those are all questions that we can address, but I'm particularly interested, Rabbi Sherman, in, you said your parents didn't talk about, like, it's a shanda, like, we're not going to talk, like, what happens, you know,
Right.
that you weren't included. You're
Right.
living here. You know, what were we going to do? Like, he's just going to come now? Or,
Yeah,
and
so,
what I read
yeah.
right before you answer is something also really interesting. And I think about it with my own children, is they would, I mean, I like to think they would care for their sibling, and they want to, and they love her. But you're on with your life. You're a rabbi, your wife's a rabbi, you have other children. So your idea might be to put her in a group home or a Jewish home or something like that. So you have to find a home. And then your idea of her care might not be her idea. And that's what, Becca, you can talk about that. Like, her feelings are, I'm always going to be with family. So there's like this whole dynamic, like, what would you have done? How did you deal with
Mhm.
all of these thoughts when you went and sat in Michelle's trust thing in the back of the room?
Yeah. I'll go back to my bar mitzvah for a moment. And I didn't realize that I said this until, this is a crazy story, but after my brother passed, I got a Facebook message from a girl that I was in Hebrew school with, basically, who went to my dad's synagogue. And she said, I have no idea what your dad told me at my bar mitzvah, but I remember what he told you at your bar mitzvah. I'm like, can you please remind me? And I guess I said, you know, how much do rabbis make and how much do doctors make? And my dad asked me why. And I guess I said as a kid, because I want to take care of Eyal when you can't. Now, I didn't remember saying that. And strange, by this woman who messaged me, she actually passed away last year of breast cancer. It's like this crazy story. And I have this message from her, and I watch her dad now, who lost a child with going through that. So, but for instance, when we were, when we ever look at a house, and my wife would be like, well, are we looking for a room where it can be accessible? I said, I don't know. So, right, you hit it there in terms of what would that look like. So actually, when I got out here, I started talking to other people who are in, if you wish, my position. I know other rabbis in the community who were going through plans for their children, and I would ask, like, what is the expectation for your other children, and what is their expectation of themselves? And I was independent. I was in my early 30s then, and I was trying to figure this out on my own. So, like I said, again, I don't fault my parents for not doing that, but it's also an emotional aspect. Like, they always had the opinion of, go live your life. That's important, and of course, it was important to me. But also, I don't have an answer because I didn't have that, and that's why I'm really adamant that we do talk about those issues now. I mean, like I said, all the things that Michelle's talking about, I just texted my wife. I said, Michelle is an expert. Like, wow, if we had this expert, I saw the expertise happen when we moved from Syracuse to Philadelphia in 2015. I saw that was a huge move, but we did not have an expert like Michelle until I went there. So I will tell you though, it was a blessing that I did move out here because of all the research that I did find and can send back to them saying, like, Mom, Dad, I found this. This is pretty amazing. Let's talk about this. So actually, in short, I was the one who came back and said, let's have these conversations. It's really important for me. There's 5 of us, and I also understand when there's not any other sibling, but the 5 of us, by the way, I'm in LA, my other sister's in LA, my other sister's in London, right? And my other sister was Cherry Hill, New Jersey. So there was really nobody, if you wish, geographically there. So it was the chill. I would call my siblings. Can we talk about this? And it was hard. It was really hard to bring up those conversations. But I think now we are open with that, and we need to be.
So one of the sentences I've said at Mount Sinai since the day I started or learned was initiating the conversation. It's like my sentence, initiating the conversation. So it could be about advanced planning, it could be about mortality, it's always about providing information and education. I'm not initiating the conversation. This isn't the conversation. We're here saying we're here for you, and we're having a conversation and doing the best we can to share our stories. And then everybody who's on here, who's asking questions, I know as we're going, Michelle is answering them as we go. We've really been hit with a lot of wonderful questions, and we are going to share them with everyone, in an email within the week, as I said. But the hope is that we end this tonight, and when we end it, whether it's with a spouse, a friend, clergy, one of us, that you initiate the conversation in your comfort zone. So we're here starting this dialogue, but really the conversation, the engagement, I hope happens, once we're off of this webinar. So I have this like little list here, and every single place I looked when I started looking at this, what really happened was I met with Rabbi Sherman, then I met with Michelle. And when Michelle like explained the special needs trust, I thought to myself, how come nobody at Cedars or UCLA or like all these social workers come in and talk to you? And you're in the hospital for months sometimes, and or you're back and forth in first name basis, like, hi, how you doing? How come nobody ever came up to me and said, hey, the special needs trust? And the reason I brought up this, I just want to say I brought up this list because there's nowhere that it doesn't say like life care plan, pick a guardian, whatever, but every single list says establish a special needs trust. I never even heard of a special needs trust, but that's the only thing that shows up on every single list that I'm looking at. And to go to your point earlier about people with wills or having siblings, adult siblings that you anticipate will care for your child. One thing is that they talk about you can have a will, you can designate a guardian, you can do all of these things, but unless you have the total picture, it's ineffective.
Right.
So,
Well, one big problem is sometimes parents will do things in their will, like they'll disinherit the child with special needs trust. And the thing about the disinheriting, you're disinheriting probably the kid who needs the most help. So it's much better to get a special needs trust. You can do it through any trust and estate attorney. If you wanted to use our pooled trust services, were available as well. But we've also seen instances where, let's say there's two children, one has special needs, one doesn't, and the mother will say, in her last days to the one who does not have special needs, I'm giving all the money to you, Betty, and you need to take care of Karen. And Betty, says, okay, Mom, what else is she going to say? But then, 6 months or a year down the road, Karen is, driving her nuts and texting her 20 times a day. And then, a better solution needs to be found. So it's really unfair to expect your typical children to just completely, I think there's an expectation that parents have that the non-disabled siblings will just kind of pick up the stick and keep running with it the same way the parents did. And that's not really fair. And that's where the planning ahead is really important.
So
I just wanted to touch upon how we're talking about how parents need to plan. It may be important to talk to your child and all of your family members about what they want. Your child with disabilities may have the capacity to explain what they want, and that's important throughout the process. Just so they feel empowered and they're making the decisions with their family.
Yeah. I actually asked you, Rabbi Sherman, this is obviously personal, and you said it was okay that I brought it up. Because there's obviously, we're all interested in the pragmatic information, but I had said to you when you got married and moved away, so you were talking about, that wasn't expected, right? You're all going to stay there and be this family, but you got married and moved away. So I was thinking at the time about, who's going to care for all as your parents' age, your siblings, you're supposed to stay around. That was what was expected, I guess, because there was no plan. But then I asked you, I took a step back because I had spoken to Becca about their needs, like their feelings. And I know Ayal was nonverbal, but he knew what was going on. He knew what was going on around us. So I asked you about your wedding, and getting married. And it wasn't so much like, could he come to the wedding? Could they be there? But that feeling as a sibling, there's a whole bunch of dynamics going on with special needs in the family. And you got to get married and move away and start your life, and how that affected you. I know you said at your bar mitzvah that you didn't remember that you wanted to take care of your brother, but now you're getting married and moving to LA.
Mhm.
So, did your parents envision that? Like, how did that affect you? How'd that affect Ayal?
Well, so
What
actually,
happened in the life plan?
same
that
thing that your
was
daughter
defined?
said the other day. You said, I'm not going to have that. And actually, when my older sister got married, my first older sister got married, he verbalized that, right? So, I'm not going to have that, or I'm sad because they're moving away. But interestingly enough, also it took the spouses of me and my siblings to not open up our eyes, but also you talked about like how to have that conversation, right? Because like, yeah, as we started, Michelle and I started what this normal thing is, right? For Michelle, you have a normal, I have a normal, and everybody else out there has a different normal, if you wish, right? Just generalizing. But all of a sudden an in-law comes in, they're like, oh, what am I stepping into, right? I actually remember, I know it's on record, but this person won't hear it, but somebody I was dating in college, and they were like, no, I can't do this, right? Like, I know I see the future, right? And I don't know if I can handle that. So we talk about siblings, but as siblings get older and create families, you're also, as when you marry somebody, you're marrying their family, and they're marrying your family. So that was also eye-opening, but also in a beautiful way eye-opening, that my wife, also a rabbi, she opened us up to ask those questions, like, what am I marrying, right? It's not normal for her to come into the house. So what does that look like going forward as well? So yeah, there were the emotional aspects of that. I mean, we're all on Zoom right now, but we were one of the first couples to put Skype under our chuppah and have people do a Sheva Bracha that way. And that was non-COVID time. So, but now, like, why wouldn't you put a computer under a chuppah? So that was, blessings that way as well. But yeah, no, we always created an amazing sense of normalcy. Like my sister just got married during the surge in Orange County, and her family member said, my parents couldn't be here based on COVID, not based on health reasons. They said, well, how can you do that? Like, how can your parents not walk you down the aisle? And she was like, I've been down that rodeo before. Like, we're good. Like, right? We're getting married here. And we understood that there was a greater good than how many people would be standing at that moment. So sometimes it's a shift in terms of how we think about things. My dad, and actually somebody texted me on the chat here that my dad is Rabbi Charles Sherman, who his book is The Broken and the Whole. I know somebody said it, asking if that was my dad. But he says in that book, you can be sad and you can be happy at the same time. And I think not compartmentalizing things, but realizing that life is an ebb and flow of all these emotions and all of these experiences. If we only compartmentalize sadness, then we'll never get out of that. If we only compartmentalize happiness, then we'll sometimes never get into it. But if you realize that you can be happy and be sad, and those are both acceptable at the same time, that is, I think, how we not dealt with it, but created that sense of created that life together.
Michelle, someone has asked a couple of times, and I want to address it because we have such a diverse community. Many of us have children or grandchildren out of state, or we've moved here, or they moved, or whatever. Being a Jewish community, obviously we have a lot of people, thankfully, that make Aliyah, move to Israel. So we have someone on that has grandchildren in Israel. What is a trust work for that if you have grandchildren out of the country?
Yeah, the trust could still make disbursement. The thing is, when they first enroll, they need, for us, because of the terms of our master trust, they have to be living in the state of California.
Okay. Well, the child?
Yes,
Or
the beneficiary.
Okay, so the child
Beneficiary. Yeah.
So to the guest who asked that question, we'll do a little research and see if there's something we can help you with in Israel.
Well, I mean, Israel has got a whole network of social service.
Okay. We're just curious about this. I just wanted to offer that.
I have a question actually then, Michelle. You said the beneficiary needs to be in California. So would that mean, like, when I saw you the first time, I theoretically couldn't sign up for what you are doing? Is that correct?
Well, it wouldn't be you. It would be your brother. He's
right.
He would have been the beneficiary. Right.
Right. So that's what she's saying. So theoretically,
as a sibling here in California, I would. bad.
No, because the reason why, because remember, the main reason to have a special needs trust is so that you're eligible for those means tested government benefits. And a lot of that comes through the state Medicaid agency. In California, we call Medicaid Medi-Cal. We like to name everything a little bit differently in California. So because of the way state Medicaid agencies are set up, the beneficiary has to be living in the state of the Medicaid agency. So right now, our master trust only covers California, and we actually really try to mostly enroll people who live in Southern California, because we want to be able to drive, and after COVID, and before COVID, we want to be able to see our beneficiaries face to face. Some people have been asking about case management services. We can only provide, internally, we only have enough staff to provide limited case management. And if people need more case management, we contract out with Jewish Family Services, we contract out with Live Home. And then we become kind of the coordinating hub. And the same is true with, a lot of people are asking about regional center clients. So once someone is a regional center client, they typically remain a regional center client their entire lifetime, unless they move out of state. Because again, it has to do with the funding, because much of the regional center funding is actually Medicaid waiver funding. So not to get too wonky on everybody, but so in other words, just to make it simple, we can only help people who are living in California. If you live in another state, the beneficiary is living in another state. Like I said, there are other pooled trusts run by nonprofits around the whole country. And I'm happy to make a referral. And most of them are run by middle-aged women who look a lot like me. No, they don't look a lot like me, but often have similar backgrounds as parents, social workers, some are attorneys, some are CPAs. But it's interesting, actually. It happens to be a very female-dominated area. And the same with people were asking about what happens if I don't have anyone else who can be, who can make day-to-day decisions, what a conservator does. So if you don't have a family member who can be a conservator, there are professional conservators you can hire. And the question about who supervises them, they do have to report to the court every year. And if there are irregularities, they could be challenged during those annual court accountings.
Okay, so in the interest of time, I noticed that a lot of people are referring to people who live out of state or out of the country.
Right.
I just want to make sure that everyone who is our guest tonight is not discouraged. We're here to, as I said 10 times already, help you. Michelle has a breadth of experience and resources, so do not feel discouraged like this is just another dead end. We're here to help you. We'll figure something out. We'll reach out. I know that Rabbi Sherman has said several times, I hope I'm not speaking out loud, that he has an open door. He has people all the time coming to him, and he wants to be there for the community. So if you have needs, specifically personal, emotional, something of a rabbi, or just direction, having lived and grown up his whole life, he's there to help the community. And Michelle, as you know, she's the expert. I do want to touch on advanced planning, because the reason that we really wanted to have this discussion is it does affect our entire community at every generation. We have grandparents on here, siblings on here. And one thing I've learned about initiating the conversation is that if you have a plan, they always say, like, if you have money, that makes life easier, right? So we all have the same thing, but if you have money, it's a little bit easier. The truth is, if you have a plan, it makes things a lot easier. And I've met many people who have come in, who have looked at advanced planning property, things like that, said, okay, yeah, I like it here. I'll let my kids know. And, when the time comes, we have money, they'll pay for it or something like that. And it's not about that. Rabbi's not here selling his synagogue. Michelle, you're not here selling a trust. I'm not here selling advanced planning burial spaces. We're here to talk about making a plan and seeing the entire picture so that the choices you make are effective for your family, because the emotions can really cloud things. And I know when I was speaking with you, Michelle, before the webinar, you had mentioned something that I never knew about the trust, of something with SSI and not being able to use something for funeral expenses. And I got to thinking about this movie, Peanut Butter Falcon. I don't know if anyone saw it, but this movie, and I thought to myself, like, if he was a Jewish child, you know, and I grew up, I know I wanted a Jewish burial. So I'm just wondering, I could leave all this money and do all of these things and set everything up. But what happens when his or her time comes? Is she going to end up at, you know, Forest Lawn, or are they going to have a rabbi? Is there going to be everything that I would have wanted for the child? Or, as Becca has said many times, what the child wants for themselves, if they're able to answer that. So a plan is of the utmost importance. And I never thought of that. Although I do advanced planning every day, I never thought of what could be used or who would make those decisions at that time if I wasn't there.
Right. Well,
So
if the only money is in the trust, and if the beneficiary receives SSI, you have to make arrangements prior to passing. Because
right. So
after the beneficiary passes, you freeze the assets. You can only pay off bills that were incurred prior to the passing.
right. So the reason I brought it up was not because that's like my area. I just brought it up because we've said this over and over again, that a plan is so important. And we rely on siblings, adult siblings, but who knows if they're going to be married and living in California. We don't know what we don't know. And as much information as we can get can only prove beneficial. So I don't know if you have any, it's already past our time. So Rabbi, do you have any closing remarks?
I just want to say, we're talking about plans for special needs, right? But I can't tell you how many people call us when a loved one passes and then say, what do I do? And then I say, oh, is there a plan in place? I said, no. So I've learned that obviously over 10 or 11 years as a rabbi as well, that, it's not just for special needs. And
right.
in the rabbinic terminology, it's called kal v'chomer, even more so in the situations that we're speaking about. But even if you're not in that situation for your own self, right? So that can be taken care of, because who even, takes care of that? As I said at the beginning, it worked backward in my family, that once we had to have a plan, then everybody else's plan, went into place. But I'll just give you one example that was interesting, right? We didn't have a plan. My brother had passed, and then we went to the cemetery, and like in that moment, we had to choose a plot, right? Well, never thought about that. And then actually several months later, we ended up moving the plot because my parents were not satisfied, if you wish, with the location. And that was a really emotional experience that I also, wish we didn't have to go through. I remember that it was tough, but again, I'm not second guessing what happened, right? I also completely understand if I was in my parents' shoes, right, what that would be like on a day-to-day basis. But now that I have 20/20 vision, if you wish, I can also say, wow, if A, B, and C also, that would have been, just a little different. And like I said, I'm here to advocate. And also, I'm not here to sell a synagogue, but somebody asked me today, what's the Jewish value that I've learned in the pandemic? And I actually think the one thing that I've really learned is al tifrosh min hatzibor, do not separate from community. I have performed funerals on Zoom that I never want to do that again, based on obviously health reasons. But even when we had to do that, because people were connected to a community. So wherever you are, if you're not connected to a community, I highly do encourage that, because that community, right, when you come to me, when you come to another rabbi, wherever you are, that community will have also the people that you don't know that are also willing to extend that hand and saying we're here as well.
Thank you. Becca, did you have something you wanted to add?
Yes, I spoke with the organization EDA, and they provide education and supportive services. And Josh Taft, who is the director of intake, kindly offered that we can give out his email address. So I can type that into the chat, and he's available to answer any questions. I saw some clinical questions, and that's probably not within our scope. And he would be the perfect person to ask about, planning and more clinical information.
Yeah, EDA is
Great.
wonderful. That's where my son gets his services through the regional center. And they have, and somebody else had asked at the beginning about group homes. So the only Jewish group homes in LA County are run by EDA. And there's I think one or two other Jewish group homes actually out in Palm Springs, run by a different agency. But in general, the trend is away from group homes and to more independent supported living. So even people with very severe disabilities living with what's known as SLS, supported living support, usually through the regional center. EDA is the name of EDA is not an acronym. It's the name of their original founder, a wonderful lady, an Orthodox lady, who was the first one in LA to teach Orthodox kids with special needs Hebrew and Judaica.
Yeah, it's a wonderful organization. So I know Becca said she was going to type it into the chat. I know Michelle has written a number of answers. I don't know if they've gone to all the attendees or just to the individual, but as a reminder, we're going to be providing all the questions and all the answers to everyone. We will not have your names, so they'll be anonymous. And we will be providing contact information for Josh, Rabbi Sherman, and Michelle. My information is there as well. And in closing, I just want to thank everybody for joining us. Definitely want to thank the panelists because of you volunteered your time and shared your story and your expertise. I know that you all have so much more to talk about. I have heard actually Rabbi Sherman speak about his brother and his father. The book is amazing, but it's so wonderful to hear a sibling's perspective. But I want to add that we are all different. And Rabbi Sherman he said, it's okay to be happy and sad. And you had, your normal was a quintessential childhood and that's all you knew. And it's very interesting. My household isn't like that. And I'm not embarrassed to say that. In fact, I work a lot. And Becca once said to me, and I actually felt bad. I'm sorry to put you on the spot, Becca. She said, do you stay at work so you don't have to go home? And no, it's been the pandemic and I hope we never have to work like we've worked again. I'm with Rabbi Sherman on that. But I could understand where she was coming from. Love my kids, love my life, but we're not, the siblings aren't like hip, hip, hooray, cannot wait, let's, sing songs together. So please, you're laughing, Michelle, but please know to our guests, who have joined us, it's okay if everything isn't great. It's
I'm
okay.
very conscious of that. I would really want to make that point, right? That's really important. I'm extremely conscious of, yes, my parents are married still after 50 years, but there are other families who are not, and this breaks families. And I think it's an extremely important point. And I want to make sure that comes across clear within my own set as well. There's lots of mental health issues, I think, that go in here that are only coming out.
Yes.
Right.
Yes. So
and I do know that many of our guests, because I know from people who have come in here and talked about their children or adult children, a lot of the illnesses are invisible. It's not as easy to identify. Don't feel that you're not a part of the community. If you are here with us tonight and you're fall under the umbrella, and I don't hate to, define special needs, but if you need help, as Rabbi said, the community is very important. Stay connected, reach out. And I thank you again, Becca, Rabbi Sherman, and Michelle. And I thank everyone for joining us tonight. And you will be hearing from all of us within the week. So thank you so much. Good night, everybody.
Thank you. Good night. Chag Sameach.